I'm Kara O'Donnell, and this is County Board Wrap-Up, Arlington Television's monthly deep dive into the County Board's actions on issues that affect you, your neighborhood, and our community. As you can see, this episode comes to you virtually once again today, and joining me today from their homes are Arlington County Board Chair Libby Garvey and Board Member Christian Dorsey. Thank you both for joining us.
Thank you for having us.
And of course, this month, just like last month, we're going to be talking about the issue that's affecting each and every one of us. And of course, that is COVID-19, including the board actions from this month on reopening, as well as expanding support for our business community, as well as our residents who have been hit hard by the economic fallout of this pandemic. But we're going to start by talking about the reopening plan, the gradually getting into the area of phase one. And I guess the question that's on everybody's mind is, when is that going to happen?
Well, we did say, in our letter to the governor that I sent with a group of my colleagues from Northern Virginia, that the date is going to determine this, not the date. But I think we're all kind of aiming to the date of the very end of this month. And of course, the rest of the state has already moved into phase one. But we are, as I think everybody knows who lives here, Northern Virginia is a different kind of place than the rest of the state, very connected with the District of Columbia and what's going on in Maryland. And the virus has been much more active here. So the governor, and which I think was great last month, actually laid out the criteria for moving to phase one. And that was, downward trend in percentages in the number of cases and over 14 days see this downward trend. Number of hospitalizations, also making sure we had enough hospital beds and that we had some increase in testing and contact tracing. So it was clear a week ago when the governor was poised to move the state into phase one that we here in Northern Virginia really didn't meet any one of those metrics. Some of them we might, but we just really didn't even have the data. So we came together and our public health directors really and set out what the data was, and they all agreed and came to the elected officials, and we then attached their memo to us and to the governor about what was going on, and said, we're not. Here's the data, and we agree with your criteria, but it doesn't show that we're ready to move into phase one like the rest of the state might be. So the governor agreed. So the rest of the state has moved into phase one. And we're still at phase, I guess you'd call it phase zero, but I expect us to be moving into phase one pretty soon. And I'll invite Christian to say some things. We've got some indications that, I think we'll be ready to do that by the end of the month. Christian, anything you want to add?
No, I'm really supportive and proud of the region for coming together to actually stand up for what is happening here in Northern Virginia, so that we just didn't lump in the entire state together to really mask the unique issues that we were experiencing. And as much as we're proud Virginians and proud to be a part of the Commonwealth, we recognize that most of our residents have their mobility that goes through not just the Commonwealth, but Maryland and the District of Columbia. So to be ignorant and blind to that interaction would have been at the peril of everyone's health and safety. So the way we've proceeded has been responsible, and it looks like, as Chair Garvey has said, that we will be entering phase one relatively soon enough.
Now, what needs to actually happen for the county to hit those phase one benchmarks by the end of the month? What are some of the metrics we need to meet? And do you see any kind of indication that perhaps we would need to seek an extension for that? Are we on the way?
Well, I think we're on the way. Our hospitalizations have been going down, not fast, but they're on a downward trend. And we think the number of cases as well, although that may pick up as we do more testing. The really important thing that we were lacking here was this ability to really do broad testing to know what is happening, so we can make sure we get to the containment. And if you're going to do containment of the virus, you got to know where it is to contain it in, right? And we're about to launch in cooperation with the state on this coming Tuesday, testing at the Barcroft Community Center, actually there in the parking lot in the garage. And we're planning to do about 1,000 tests. And people will not need a doctor's order. They won't even need to exhibit symptoms. And we're trying to get particularly folks who are underserved medically, may not have a doctor, may not have, but they are in, jobs that expose them to this virus quite a bit, and often living in tighter living quarters. And that's where we really need to be aware of where is the virus in that population so that we can start to contain it if we find it. So we're going to do a lot of testing that day, and I'm very hopeful that is the beginning of at least a weekly broad testing like that, because we're going to need to keep this up for a long time. We will be at the end of the 5 larger jurisdictions, Loudoun and our partners in Fairfax County and Alexandria are all going first before us and Prince William, and then we'll be doing it, and that's all being done in the space of about 5 days. 5 working days. And then hopefully we're going to just keep it going, because the whole region, again, as Christian was pointing out, we're really all in this together, and we need to be doing this kind of testing to know where that virus is, and then the contact tracing to follow up for people who test positive.
Now, one thing I think folks obviously were a little, it can be frustrating to hear the rest of the state is going to phase 1. We had to take a little pause there, but others are calling it an opportunity, and that's giving our businesses, our various entities, a chance to really prepare and make sure we're doing phase 1 right, so to speak.
Yeah.
What are some of the things that they can be doing here in the meantime to really prepare?
Mm-hmm.
That's a great question. And Kara, I'm glad you brought that up, because this delay, or at least the separate date from the rest of the Commonwealth, helps us actually plan to ensure that once we enter phase 1, we don't have to step back and impose restrictions later on, which would really hurt businesses. So this extra couple weeks, if you will allow businesses to start thinking about how they operate with reduced occupancies, how they think about maybe outdoor space as a way to expand their ability to promote responsible social distancing. It also provides them an opportunity to help get their workforce back engaged, to hopefully do what I would love to see them doing, and providing opportunities for them to do wellness checks when they have employees come and engage with the public again. So this really is, I think, an opportunity to get this done right, as opposed to what we're seeing elsewhere in the country, where people have hastily reopened. They've been overwhelmed by either demand or not having the workforce ready, and they've had to close down again. We don't want that at all. We hopefully want our businesses to enter phase 1, and then steadily we see an upward arc as opposed to going backwards and forwards.
And I think it's going to allow us more time to get the message out again. We don't have them yet, but we're hoping soon to have enough cloth face coverings for everybody in the county. And the expectation will be, all the businesses will be using it, all of our employees will be using it, and we hope every member of our public when they're out with groups of people. And it just gives us another couple weeks to kind of socialize that, hopefully get the masks. We don't have them in hand yet, although a lot of people have them, and there are ways of making simple ones. But I think, as Christian said, the crucial part is to kind of get prepared and do it right. Put down the marks. I mean, a lot of them we see, they're marks where you're supposed to stand, how you're supposed to do it. And we're doing a lot of work, I know, looking at where are there areas, say in the street, where we can push out and restaurants can do dining out, and maybe we take over a little bit of the public right away for dining. But we have to work that through carefully. And I think we're also working on signage. I think we may come up with some more creative kind of messaging out there about, one, where people are supposed to stand, how many people are supposed to be there, reminding people to wear face coverings. So there's a lot of work to do, and I can't guarantee we'll be totally ready when it's time, but we'll be a lot better prepared. So that's helpful.
All right. Well, fingers crossed.
Yes.
We are going to take a quick break now, and when we come back, we're going to ask the board members about that $20 million in federal emergency funds will be used for, as well as steps the county took this past month to protect low to moderate income renters living in committed affordable housing. Stay with us.